anti-adrenergic drugs or sympatholytics. So these are the drugs which can block the actions of noradrenaline or can prevent or block the actions of sympathetic nervous system. Starting with alpha adrenergic blockers, alpha antagonist. So these are the drugs which blocks the alpha adrenergic receptors and the blocks the actions of noradrenaline or adrenaline through the alpha adrenergic receptors. So these are the chart already discussed, the alpha receptors, their location and what are their actions. And all these actions can be blocked by using alpha adrenergic antagonist. Classification: non-competitive and non-selective. Non-competitive, they do not compete with the noradrenaline or adrenaline, and they are non-selective, they can block both alpha 1 and alpha 2 receptor. Example: phenoxybenzamine and dibenamine. Competitive, compete with the adrenaline or noradrenaline, but non-selective on alpha 1 and alpha 2. Example: ergotamine, ergotoxin, tolazolin, and phendolamine. Alpha 1 selective, this is more important in clinical point of view. They selectively block alpha 1 receptors. Remember, alpha 1 receptor, the prominent location is on the vascular smooth muscles. It produces vasoconstriction. So if you block alpha 1 receptor, it can produce vasodilatation. Example for the drugs: prazosin, terazosin, doxazosin, trimazocin, and tamsulosin. Tamsulosin is given separately because it is a drug of choice for BHP, benign hyperplasia of prostate gland. Alpha 2 selective, only veterinary uses, yohimbine and raulosin. Pharmacological actions of alpha 1 blocker. So they already mentioned prominent area or prominent location is the on vascular smooth muscle. It produces vasodilatation. So the vasodilatation will be prominent on arterioles, producing arteriolar dilatation, reducing the total peripheral resistance, and decreases the afterload, that is the pressure the heart should overcome to pump the blood into the aorta. So that will be reduced and it will reduce the work done by the heart. And decrease in TPR definitely decreases the blood pressure, because blood pressure depends upon cardiac output and TPR, that is total peripheral resistance, or also known as peripheral vascular resistance. While other side, it also produces venodilatation, dilatation of the veins, resulting in decreased venous return, what we call also preload, that is the load which is being given to the heart or amount of the blood coming back to the heart. And because of decreased venous return, as per Starling's law of heart, there will be decrease in force of contraction, leading to decrease in cardiac output. So altogether there will be decrease in blood pressure, and this is a drug highly useful for treating hypertension. While the arteriolar dilatation, any drug which produces arteriolar dilatation, they can lead to a side effect known as reflex tachycardia, because the fall in blood pressure because of arteriolar dilatation will be tried to overcome by the body by sympathetic stimulation, which will result in increase in heart rate, resulting in reflex tachycardia. While on other side, the venodilatation or dilatation of the veins will result in peripheral pooling of blood and will reduce the venous return to the heart. So if the patient is on supine position, the effect on gravity on the blood flow back to the heart is less. But when the patient suddenly stands up, the gravitational force pull the blood down, and there will be sudden decrease in the venous return, and there will be sudden fall in blood pressure. The condition is known as postural hypotension or orthostatic hypotension. So any drug which produces venodilatation will produce postural hypotension. Along with that, it also causes flushing and also headache. So the action: reflex tachycardia and palpitation already mentioned. It can produce postural hypotension. It's known as first dose effect. because the slowly tolerance will develop on continuous use of the drug. So postural hypertension will be more prominent on the initiation of treatment. Nasal congestion because of vasodilatation of the blood vessels in the nasal mucosal bed. Meiosis because loss of or relaxation of the radial muscles of iris leading to passive meiosis. Salt water retention because of sympathetic stimulation, reflex sympathetic stimulation in response to fall in blood pressure, increasing the renin release, activating RAA system, renin angiotensin aldosterone system. It can also decrease the tone of prostatic as well as bladder neck muscles, and that's why these drugs are highly useful in treating BPH or BHP, benign hyperplasia of prostate gland, and improve the urine flow in such patients. It can block the contraction of vas deferens and other organs related with the process of ejaculation and can inhibit ejaculation, which can manifest as infertility in male patients, an embarrassing side effect. Adverse effect of alpha-1 blockage, already mentioned, postural hypertension on initiation of therapy because of venodilatation, reflex tachycardia and palpitation, salt water retention, nasal congestion, inhibition of ejaculation, headache, flushing, and diarrhea. Uses of alpha-1 blockage. Non-competitive and non-selective alpha blockage, they are highly useful in case of pheochromocytoma, tumor of adrenal medulla, massive secretion of adrenaline and noradrenaline. In such condition, non-competitive and non-selective alpha blockers are found to be useful along with the beta blockers. Other uses are useful in hypertension, especially alpha-1 selective blocker, along with the beta blocker and diuretic. The reason is when alpha blocker is given, there will be reflex tachycardia, which can be prevented by giving a beta blocker, blocking beta 1 receptor in the heart, decreasing the heart rate. And the salt water retention can be prevented by using diuretics. So usually alpha 1 blocker will be prescribed along with a beta blocker and a diuretic. It is also useful for benign hypertrophy of the prostate. Tamsulosin is a drug of choice because it is highly selective for the urinary bladder and prostate neck muscles. You can see the condition, it's a diagrammatic representation. You can see also other drugs which are used for BHP, that is 5-alpha reductase inhibitor, finasteride, which will prevent the activation of testosterone to 5-dehydroxy testosterone. It is also useful for secondary shock, peripheral vascular disease, especially Raynaud's phenomenon and acrocyanosis, congestive cardiac failure. The reason is it reduces the preload and afterload. Beta-adrenergic blockers or beta antagonist. They selectively blocks the beta receptase. Coming to the classification, beta antagonist, competitive but non-selective. Classical example, propranolol. It is a prototype drug, highly important. Sotalol, timolol. Pindalol with intrinsic sympathomimetic activity. I'll come to that later. Labetalol and carvedilol with additional alpha-adrenergic blocking property. And cardioselective or beta-1 selective drugs, which are highly selective only for beta-1 receptors, which are mainly located in the heart. So they are known as cardioselective beta blockers. Atenolol is highly important. Metoprolol, acebutolol, esmolol, nebivolol is the latest one. Celiprolol, bisoprolol, betaxolol, and they are also safe during pregnancy compared to non-selective beta blocker, because non-selective beta blocker can cause vasoconstriction of the umbilical blood vessels and reduce the blood flow to the fetus. But cardioselective beta blocker do not produce vasoconstriction. Pharmacological actions of non-selective beta blocker is being selected, that is propranolol, so that all the actions due to blockade of beta receptor can be discussed. Cardiovascular system, they tends to decrease the heart rate, force of contraction, cardiac output, but it is not prominent in the normal individuals. It is prominent in individuals with a sympathetic overactivity. Effect on blood vessels, it can produce vasoconstriction initially and increase the TPR. But gradually, the blood vessels will develop resistance to that adapt to the chronically reduced cardiac output. But the vasospasm of the extremities may continue. That can lead to a process known as Raynaud's phenomenon. That is the vasoconstriction of the blood vessels supplying to the extremities, resulting in numbness and coldness in the extremities, like in the palms and the feet. The fall in blood pressure due to beta blockers are mainly due to decrease in heart rate and cardiac output, reduced release of noradrenaline, and due to decreased renin release from the kidney. Effect on respiratory system, it produces bronchospasm and it can be dangerous in patients with a history of asthma, so should be avoided. CNS, some behavioral changes, forgetfulness, nightmares on long time uses. It can also useful in case of anxiety. It can give a symptomatic relief from anxiety because the symptoms of anxiety is similar to that of sympathetic overactivity, which can be reduced by using non-selective beta blocker. Metabolic effect, it can reduce adrenergically induced lipolysis and decreases the plasma free fatty acid level, can reduce gluconeogenesis. It inhibits glycogenolysis from the skeletal muscle and in the liver and tends to reduce the blood glucose level. But there's a complication with that. That is, if a non-selective beta blocker is administered along with insulin at the same time, it can delay the recovery from insulin-induced hypoglycemia and also can mask the symptoms of hypoglycemia. So usually when insulin is administered, there will be hypoglycemia, but it will be recovered in the normal physiology due to the release of glucose from the skeletal muscle and liver by glycogenolysis due to sympathetic stimulation. But it will be blocked by beta blockers. And the symptoms of hypoglycemia like palpitation, sweating, tremor are also due to sympathetic stimulation, which will be also masked by the beta blockers. So that makes for the physician to difficult to identify the condition of hypoglycemia. Effect on skeletal muscle, it can inhibit adrenergically provoked tremor and it reduces the exercise capacity because of decreased glucose supply. Effect on eye, reduces the secretion of aqueous humor and decreases intraocular tension, useful in glaucoma. Adverse effect of beta blockers, bradycardia, alteration of carbohydrate and lipid profile, reduce exercise capacity, bronchoconstriction or bronchospasm, dangerous in asthmatic patient. Long time use, it can cause xerostomia because of decrease in mucin secretion. Rebound hypertension on sudden withdrawal, non-selective beta blocker are restricted from sudden withdrawal. Cold extremity, that is Raynaud's phenomenon, especially on initiation of treatment, and block the early symptoms and delay the recovery from insulin-induced hypoglycemia. Uses of non-selective beta blockers, they are highly useful for treating hypertension, angina pectoris, but it is contraindicated in variant angina because variant angina due to the vasospasm of the coronary blood vessel. So non-selective beta blocker will promote the vasospasm, so it is contraindicated in variant angina. It is useful in cardiac arrhythmia, congestive cardiac failure, secondary prophylaxis of MI, glaucoma, pheochromocytoma along with the alpha blockers. Thyrotoxicosis gives a symptomatic relief. Migraine prophylaxis because of vasoconstriction. Anxiety, symptomatic relief. Essential tremor, it reduces the neurohumoral transmission or prevent the facilitation of neurohumoral transmission. Descending aortic aneurysm. Thank you.